Hello, friends, and welcome to another episode of the Concussion Nerds podcast. I am so excited you're here. We're going to talk about a fun little topic today. We're going to dig a little bit into the vestibular system. This system is huge. It is involved in so many aspects of how we function. But we're going to talk about a specific one today related to heart rate, blood pressure, lying to standing, all those pieces. But first, if you are listening to this and you are a clinician, a physical therapist, an acupuncturist, a chiropractor, an osteopath, a healthcare professional who likes to work and wants to work with individuals with concussion, then I'm going to encourage you and invite you to jump into the show notes right now, hit pause on this podcast, click on the link that invites you to join the Clinicians Edge. This is my new free segment where you are going to get a weekly dose of neuro wisdom in your inbox every single week to help you stay leading in this space, to challenge your thoughts, to help you ask questions, to learn new tidbits, new gems. Jump below, sign up for that. And I'm just going to drop this other bit too. If you do sign up for that, you get a special pricing offer to my foundational 4-hour Rethink Rehab workshop, which when you hear today's podcast episode, I'm thinking you're going to want to jump in on because we're going to go deeper into some of what we talk about today in that workshop, and you have lifetime access to that workshop. So please do jump down, check it out, and join us in the Clinician's Edge and in Rethink Rehab. So here we go. The vestibular system is for lack of a non-professional term, a honkingly huge system. And it is involved in so many different aspects of how we function as a human. And in persistent concussion, I always say there's two things that I see missed repeatedly in people who come to work with me. And let's keep in mind, although sometimes it would be nice that I wasn't practitioner number 20, 30, 40, and that people found me sooner, very commonly, I am the clinician that people come fly to work with after they've exhausted what's in their area already. I fully understand why that happens, right? So they've seen multiple providers at this point. They're usually stuck. And then they take the decision to come fly out and work with me, and we get them moving forward. And so because that is the common client that I work with, I have the unfortunate privilege, I guess, that I see the same things missed over and over and over and over again in these individuals. And a piece of that is an element very commonly within the vestibular system. And that piece within the vestibular system that I see missed quite often, and I've talked about this before, but is the otolith. And today I want to talk about a very specific reflex that the vestibular system links into. And I'm going to link it to a client example. And it just so beautifully happens that I am in an intensive week this week. And this is absolutely a piece of what's happening with my current client. And seeing it start to shift in day 2 is phenomenal. So I'm going to highlight, first of all, the importance of we must look at all the pieces and the relationships and how they fit together. Let's talk about POTS for a second. And we're going to talk about POTS in the simple aspect of people are either suspecting POTS is the case simply because the heart rate exceeds a sustained time frame, 30 beats or more higher a minute. This is a terrible explanation. If someone goes from lying to standing, their heart rate increases by 30 beats or more, and it's sustained. So that means it doesn't just spike and then drop back down. It means it spikes and stays elevated. Okay. The definition of POTS only includes heart rate for the most part. However, we can't just look at heart rate. We need to look at the different relationships between these components. So for example, we can't look at heart rate and not look at blood pressure. So this is an example of my amazing client today who definitely has the diagnosis of POTS and some other things going on in her health history and persistent concussion symptoms. And in her assessment, what we actually identified is that in this moment, in this case, in her life, she's actually got orthostatic hypotension. So let's pause for a second. What is orthostatic hypotension? Orthostatic hypotension is a drop in our systolic blood pressure by 20 points or greater when we change positionally from lying to standing. Okay. This means ultimately that the blood is not getting back to our heart And therefore, it's also not getting back to our brain, which is what causes the lightheadedness, the tunnel vision can start to happen, and these symptoms. But if we have a drastic drop in blood pressure, then it makes sense that our heart rate is going to pick up and start beating faster because it's trying to compensate for the fact that our blood pressure just plummeted, right? But the orthostatic hypotension response isn't normal. But the fact that we're getting an elevated heart rate because we're getting a significant drop in blood pressure and they're slightly proportional, that part makes sense. So in that individual, and if that's the client that's in front of you, you're not treating the heart rate. You're trying to figure out why they're going orthostatic. They're having that orthostatic hypotension. That's the piece because the heart rate is elevating that significant amount to compensate for this significant drop in blood pressure. So we're not treating the heart rate. We want to figure out why are we getting this significant drop in our blood pressure, right? And so let's think about what typically happens when we go from lying to standing too, right? So we go from lying to standing, our vestibular system inputs are changing gravity, the pressure sensors in our carotid arteries significantly notice the decrease in blood pressure, and then ultimately it flows through this pattern that if we need to, we get a sympathetic activation that constricts our blood vessels to help keep our blood pressure elevated as we transition from lying to standing, right? So why isn't that happening when we have someone with orthostatic hypotension? So in this scenario, if I had just looked at this person's heart rate, because it goes up by over 30 beats per minute and it stays there, I could say they have POTS. And my issue is the heart rate, and I need to treat the heart rate. So let's increase your fluids. Let's increase your salt. Let's do all the management strategies that we talk about when we look at POTS. But when you take a step back and you start to look at the full picture of things, you're like, ooh, that heart rate is actually escalating because you're getting this significant drop in blood pressure and it's trying to compensate for this drop. We need to figure out why you're getting this drop in blood pressure. Why isn't potentially the sympathetic system kicking in to constrict those blood vessels so that you get that greater return to the heart? Let's bring in the vestibular system. Okay. So the vestibular system has a reflex that is called your vestibulosympathetic reflex. This is one of the reflexes that I never learned about in physio school. I didn't learn about it in my basic vestibular courses. This came, and I think more people talk about it now, but for me, it came with all my additional readings and things that I do in this space. So ultimately, as I'm sure you can gather by the name implies, this is a reflex that links your vestibular system with your sympathetic nervous system or your autonomic nervous system, right? The VSR, the vestibular sympathetic reflex. Guys, guess what its job is? Its job is to help maintain blood pressure, and cardiovascular stability is another term, when you move from positions like lying to standing. What? You mean you might be able to address orthostatic hypotension with vestibular work, particularly otolithic part of the vestibular system, right? So really what happens is that the otoliths and the semicircular canals all detect the changes in head position and gravity and all that piece. This information gets sent through a specific pathway to your brain stem. The part of the brain that this really speaks to is your rostral ventral lateral medulla, in case you're curious. This, in turn, as sympathetic activation, in tightening and constricting blood vessels, which then helps keep blood pressure higher so you don't faint or pass out, right? That is the shortened version of what this reflex does. Now, here's the bonus part, is I knew that this was a piece for her, particularly when we started to do the rest of her assessment, and guess what we found? Amongst our vestibular assessment, we found dysfunction in her otolith. Now, again, in concussion rehab, it's not something works and doesn't work, right? It's not black and white. We play in the gray. We play in the nuances. But we could see that there was vestibular dysfunction in this client, both a little bit of semicircular canal stuff, but also very much an otolithic component. When someone has an otolithic dysfunction and hypotension, to me, it is one of those pieces where I need to explore this to see if we can get this otolith working better and if this is going to link back in helping them not have orthostatic hypotension, which then in turn if the blood pressure is not dropping, if the heart and the blood pressure is coupled properly, then we would see a decrease in the heart rate, right? Everyone gets really stuck on heart rate. So, amongst the rest of the multi-systems assessment that we did with this person, we're absolutely doing some work in supine. We're absolutely doing some coordination of the eyes and the head and a significant vestibular component. And we have a few different ways that we address the otolithic system in my clinic. But here's the coolest thing that happened today. So today is day 2 of her intensive. So yesterday was assessment day where we identified the orthostatic hypotension, which this was news to her. We identified kind of the heart rate issues. We identified the vestibular challenges. We identified some of the neck components. We do the full picture and we look at what's working well, what's not working well, and what can speak. And this vestibular piece and the blood pressure piece really spoke to me because it's impacting her life, right? Like, let's think about this for a second. When the blood pressure drops and it doesn't come back up and your heart rate has to stay elevated, what does that mean for this person? This person, it means they're getting decreased blood flow to their brain, right? So therefore, they're getting brain fog, they're getting pressure headaches, like those sorts of things. Also, if your heart rate is continuously beating over 100 beats per minute all the time, we know there's some sympathetic activation, but we also know sometimes if it's under that piece, we're just getting withdrawal of certain things. But it's like you're running a marathon all day, right? Like that's not fun either. That's exhausting and that's fatiguing. So for this individual, today specifically, we've done a lot of work on the otolithic component specifically of her vestibular system. And I worked it all in sitting today until our final session. Because for this individual, this is important when you're working with people clinicians. If them standing is putting someone consistently in the high 90s or over 100 beats per minute just to stand, that nervous system is already working so hard that then to add another layer of a challenge may not support them and it may run them into the ground faster. Okay, so for this individual, as we were starting to kind of challenge that system and bring it online and get it to work a bit better, we started in sitting, right? I always talk about you build the micro to the macro, and that's what we did with her today. And so I was seeing signs that the system was doing a little bit better in our sitting positions. And again, we have tools to work with this. So then at the end of the session today, at the end of our last sessions, we do 3 sessions a day. At the end of our last session, we're in my gym. And I was like, okay, here's what we're going to do. We're going to move on to our feet, but here's how we're going to do it. And so I had her do a very specific head movement and exercise as we went from sitting to standing. And guess what didn't happen? We didn't get a plummeting blood pressure and a skyrocketing heart rate. In fact, things were pretty stable. So we sat her back down. And I said, okay, we're going to actually go move to my other system. We're going to do some hand-eye coordination. We're going to try it in standing. And we're going to see how your system does. She did great. That heart rate stayed within a reasonable range. She didn't feel symptomatic. She actually said she felt kind of energized, didn't get the lightheadedness symptoms. I was not monitoring her blood pressure at this point. All really positive things that's trending in the right direction. And she said, when we could actually see her, she's like, I can't remember the last time I was on my feet and my heart rate was below the high 90s, if not the hundreds. How awesome was that? But again, here's the thing to remember. I wasn't treating her heart rate. The heart rate was the outcome of the bigger issue. The reason driving the heart rate was the decrease in her blood pressure and that orthostatic hypotension, which caused the heart rate to go to where it was. And the part of, I'm not going to say the whole thing, but a potential driver to why we were orthostatic is this vestibular sympathetic reflex wasn't kicking in, for lack of a better term, because she was having dysfunction in her vestibular system due to her concussion. You see how we can't just always take something at face value, heart rate, And we need to be able to backstep to look at the relationship between that and other systems, assessment pieces, tools, and that element to then be able to step back and look at the full system and what we can do to find that root piece that can connect the dots for someone. That's what we did for this person. She also shared something really lovely with, I have a physio shadowing this weekend. So if you're part of my Concussion Nerds program, you have an open invitation to come shadow me at my clinic anytime. And so one of the nerds is here this weekend shadowing, and the client said to her, she's like, when she's done other therapies in the past, a lot of the time they push her past a limit, or it triggers a migraine, or she feels horrible. And that doesn't happen when she comes and works with me at my clinic. Yes, she gets tired. Yes, she can get symptomatic, but we've never triggered a migraine. We've never blown her out of the water. We've never incapacitated her so she can't come to her next session. We challenge, and that's the piece of also understanding, are we just trying to continuously habituate somebody to symptoms, or are we finding what is driving that symptom to then address that piece? And are we challenging appropriately? And sometimes when we're working with our clients don't know those initial warning signs. So we have to pay attention, right? What are the things that we see that are showing us, whether our client's telling us or not, but that we are physically seeing, that might be a sign to slow down? Maybe their face goes more flush. Maybe all of a sudden you just see their eyes start to drop. Maybe their pupils blow out, which I mean, like, go really big, right? Maybe they're in their socks and they step and you notice they're sweating more, right? Maybe they're talking about their hands getting colder, or they're getting more flushed, and these changes in temperature regulation things. We have to pay attention to those things, because what happens sometimes with our clients is they are disconnected from their bodies. Part of what we're trying to do is help people get reconnected with who they are. And if they are disconnected, they might be unaware of what some of those early signs and symptoms are that we're pushing their limits and we're challenging them. But it's our job to pay attention to those things so that we're not blowing people past a level where they should be challenged, because then that does set them back, right? And we don't have as effective sessions as therapists. So this was just a beautiful example. I loved that it came up today and this week, because again, the vestibular system is linked to so many different components. I have not read it, but there's a study that someone just posted in a group I'm part of that's talking about the vestibular system and osteoporosis, right? We know that vestibular rehab can help improve cognition, right? We know that it links into emotional regulation. It's so many pieces. And in this case, and what happens a lot in concussion, is that this piece, specifically the otolith piece, gets missed over and over and over again. And it is a component that can absolutely impact these other elements. So if the vestibulosympathetic reflex is new to you, go do some reading. I love it. It's a super fun one. I think it's great. If you are someone who is assessing your client for heart rate only, and you're not looking at that relationship with heart rate to blood pressure, then stop and please start looking at both, because they matter, right? The relationship between them matters. How they respond to each other tells you how the autonomic nervous system is doing, and is it coupled properly, right? And if you're stuck, or if you're wanting to learn more, or you're liking all of these pieces, come join us in Rethink Rehab or Concussion Nerds, or at least sign up for the Clinicians Edge to get some tidbits there. This topic will be one of the emails that you get at somewhere in that journey, in that weekly dose of neuro rehab. And we'll talk about it in more detail. But I just wanted to shed some light on this. We love the vestibular system. So many of us love the vestibular system. And this is just a piece of it that I think doesn't get the attention it deserves sometimes. And because I had a client this week that this was very much a piece of what we're working on, I wanted to bring it to you as well. So until next week, my friends, have an amazing day. that's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.